Thank you. Okay, so good evening, everybody. My name is Nikita Muthuuri. I'm a level 6 medical student from the University of Nairobi, and I'm happy to see you in the audience today. Thank you for joining the Amsun Career Talk, the first one of 2022. So there are a few ground rules to be observed during this session in order to have a smooth talk. 1, keep your microphone muted at all times, unless you're invited to unmute and engage vocally by the speaker or by myself, the moderator. Number 2, ensure your 2 names are on your Zoom profile for ease of identification. So when we're engaging, because we'll have a Q&A session, we're not talking to initials. And then number 3, type your questions in the chat box. They'll be addressed in due course. And finally, number 4, please keep your comments respectful. That's it. So we'll have a presentation from today's speaker, followed by a Q&A session. And without further ado, I am going to introduce Dr.Mbuvi Mutua, a medical officer at the Kenyatta National Hospital. He's been working there for almost 5 years and has been deputy head of the accident and emergency section at the Kenyatta Hospital, which is the largest hospital in Kenya, East and Central Africa, if I'm not wrong. And now he is heading the infectious disease unit, medical officer position. So he will talk to us about pre-internship, internship, working experience, and all the things that had been advertised on the poster. Karibu sana, Dr. Mbuvi. We're happy to have you. Thank you for making the time.
Thank you so much, Nikita, and I'm glad to be here. It's good to actually have this kind of forums. I appreciate the invitation, and thank you so much. I hope the lighting in my room is a bit dark, but anyway, the presentation will still be seen. Maybe just like a brief introduction. My name is Dr. Dr.Mbuvi. I work at the Kenyatta National Hospital Accident and Emergency Department. I had previously been heading the infectious disease unit as a medical officer team leader, but I transitioned back to the accident emergency department. That was basically due to, okay, at the time when I got into the infectious disease unit, it was during the height of COVID-19. And I feel like I did my part in that particular journey. And then I now moved back to what I call my hometown, which is the accident emergency department. Yeah, so thank you. Let me just share my screen so that we can begin. I just have a small presentation in regards to what we are to talk about today, and then we'll see from there. Okay. I'm seeing that I can't share my screen, Nikita. It says the host disabled participants screen sharing.
Okay, I've made you host, Doc.
Okay. Oh, hi, Castro. How are you?
I'm great. I'm great.
Hi. So. Okay, thanks. Oh, good. Okay, nice. Okay. So. Okay, so I was told that this was going to be a career talk, and I was told to maybe go about pre-internship, internship, and post-internship experience. So basically, this presentation will now be, it's actually based on what I have gone through, and which is what I have been able to see in regards to those particular areas of interest, and up to the point where I am today. So without further ado, so pre-internship really, there wasn't really much for me to talk about because I'm thinking pre-internship really mostly is just that anxiety and the actual excitement of, oh my God, finally I am done. I have NBCHB in the bag, and it's been 6 years, 5 years, and with COVID, it kind of elongated for some people to like 7 years. But then after that excitement, now you get your results, and then now it's time for the next step, which is internship itself. I know for pre-internship, there's some guys who maybe if you study in universities that are outside of the East African community, you actually come back and you are required to do a pre-internship period which is about 6 months of rotating in KNH or Moi Teaching and Referral Hospital, which are the level 6 facilities in the country. And then after that, you get examined. And then once you pass, then the Kenya Medical Practitioners and Dentists Council now gives you the license to do your internship. But that one, I think, applies mostly to guys who study like in places like China, Russia, and those are the and European and some European countries. For guys who study within Nairobi, within East African region, they don't have to go through the pre-internship. So internship. Internship is a one-year period which has so many ups and downs. For some people, it has more downs than ups. For others, they're just the same. But basically, with that cartoon that you're seeing there, that is basically what is going to be your life, given the the high workload that you have. You get tired, you get fatigued, you get frustrated. There are points where you'll feel like you want to quit, depending on which internship center you're in and the kind of support that you get, either from your consultants or from the medical officers who are employed there, or maybe even a level 6 facility with the registrars who are there. Maybe if you're doing internship in KNH or in Moi Teaching and Referral Hospital. So for internship, I know there's usually 4 areas where guys go for internship. So there's the government hospitals, which are mostly the level 6 facilities. That's KNH and Moi Teaching and Referral Hospital. And then you have your county referral and sub-county hospitals. Those are your Mbagathi Hospital, Kiambu, Thika, Machakos, those level as county referral level 5 and sub-county hospitals. And then you have your faith-based hospitals, which are Christian Hospital Association of Kenya, which is CHAK, which comprises the hospitals like Kijabe, Tenwek, Tumutumu, Chogoria, and several others. And then you have your private hospitals, your Aga Khan, Nairobi Hospital, Mpisha. So some of these hospitals are actually internship centers, and you can actually do an internship there. So given my experience in regards to internship, I did my internship at a faith-based hospital, the CHAK group, at a small, okay, I'll call it a small hospital in Nyeri County. It is called Tumutumu, PCA Tumutumu Hospital. And the experience I got there was one of a kind, given that it was a place where it was a small hospital and we were 7 MO interns, and we had an opportunity to do hospital calls. And basically a hospital call is what is basically, if you're the one on call, you're covering the entire hospital. You're covering the pediatrics, obgyn, surg, and medical departments, because the hospital was not that big. So one person could actually be able to do a hospital call. So given that we were doing hospital calls and we were 7 MOs, it meant we had more free time than let's say my colleagues who were in other hospitals. Like, for example, my colleague was in Thika, who was it felt like he was always at work 24/7. But for us, we had enough times. We had many free weekends because of the fact that we were doing hospital calls. So the things that I came to realize in internship were that certain things that you need to accomplish in internship when you're there is that, one, you need to get a mentor. If you can get one of the consultants in, let's say, once you're doing your rotations and you find that you have an interest in obgyn, if you have a good consultant in obgyn, you can actually ask them to be your mentor. And these are things that will actually help you when you're finishing your internship. You already know which career path you're going to follow. That is, if you decide to go the path of clinical practice. So you can know that, yes, I want to be a surgeon. So you can get your surgeon to be your mentor if the person actually has that capacity, because not all consultants have the capacity to be mentors. Just to be, because we're all human, we're all different, and we all have our shortcomings and things like that. And number 2 is that learn as much as you can, because once you're done with internship and become a medical officer, you no longer have a fallback plan. You no longer have an MO to fall back on. You no longer have a consultant to fall back on. They are there, yes, but there's a certain expectation of you as a medical officer. There are certain things that you're supposed to be able to do. And the only way you can learn how to do these things is doing internship. So this is where you need to learn as much as you can in regards to examination of patients and management of patients, and even acquiring skills like things like maybe doing central line insertions in theater, or learning how to intubate a patient in theater. Such things, because these things, when you become a medical officer, there's the assumption that you already know them. So when you're in a hospital and an emergency happens, the hospital will be expecting you to know if this patient needs to be intubated. They expect you to know how to intubate or call an anesthetist at that point. So, and internship is the one place where you can make mistakes as you learn, because you have the MO, you have the consultant who are there to back you up. I know for some facilities, and there are always those horror stories of interns having to pay by themselves, and when you call your second call, they don't show up, you call the consultant, it becomes an issue. Those things are there, but sometimes it's part, I'm not going to say it's part of internship life. It's not supposed to be like that, because okay, if I give an example of where I was training in Muthuuri, I was doing my internship, I never had that experience of, because my second on call and my consultants were always there. That was the beauty of being in that place. That even when I was about to make a mistake, there was someone who was always there by my side to help me and correct me where I'm going wrong, and help me to get to do the things the way they're supposed to be done, the right way that they're supposed to be done. So I feel like that is something that's supposed to be there for all interns who are starting out. You're supposed to have that experience. Number 4, which was one of the hardest lessons I think I learned during internship, was money management. What we call the boom factor is when you start your internship, you don't get, okay, in our time, you will not get paid. You didn't get paid at least for the first 3 months. So for the first 3 months, you're working and working and working, and there's no money. And then either at the end of the 3rd month, or sometimes when the 4th month, at the end of the 4th month, that cumulative salary of 3-4 months hits your account. And that's, we used to call it the boom factor. Because you just hear guys going like, oh my God, boom imeingia, as if we have boom. So when you hear boom, you know, oh yes, there's money, there's money. And I can say being an intern, and then now you get money when you didn't have money. Yeah, so basically my colleagues and I, we did the same thing. We all went, we bought TVs, we bought furniture, we bought fridges, all those things, the things that you think that you'll want during internship, and just to show that for all the years that I've worked, and this is my reward, this is the money, this is what I've been working for, this is now what I have. Yeah, now the reason I say that this was one of the biggest lessons I learned during internship was because I did my internship in 2016. And at that time was when we had the national doctor strike that lasted for 100 days. And during that period of 100 days, the government did pay us because we were on strike. And so we had, okay, 100 days like three months. So with another 3 months of no money, you know, just chilling and nothing. And then the strike ended. And we thought that since everyone else in the guys in the counties, the guys in other hospitals were going to be paid for those 100 days that they were not at work, we thought even for us as interns, we will get paid the same. Yeah, shock on us. We were told, yeah, there's no way we're going to pay you for what you did not do. So we ended up getting paid just our usual salary when we went back to internship, and then internship actually was extended by another 3 months because there's no way you could finish, because you basically missed like a whole rotation of 100 days where you've been on strike. So now you have to compensate for that. And we did that, we did our internship when we got done. Now, one of the consequences of that strike was that the Council of Governors decided that there will no longer be direct posting of medical officer interns once they're done with the internship to the county hospital. Because what used to happen before was that you finish your internship, you will take your papers back to the Ministry of Health, to the Kenya Medical Practitioners Council, and get your license, and then you'll get a posting letter. So Gava will decide, where we are sending you to Machakos, we're sending you to wherever, Nakuru, etc. All those, as in the government will actually post you, and you'll be on a payroll. But now the Council of Governors said, we're done with that stuff. We're no longer posting guys. So we finished the internship, and we found ourselves in a very peculiar place, as a place where no other doctor had been before. Basically, it meant we were now in a place where we had to figure out life for ourselves rather than having government just post us to hospitals as had been done before. So now that comment now brings me back to what we basically, I'll call the post-internship craziness of the post-internship months that happened once we cleared internship. So we cleared internship and we did all the registrations and everything, and then we're told, yeah, so Gava is not going to post you guys, so you guys have to sort yourself out. And that's where first line we tarmacked. For the first time, I think, in the history of doctors in this country, we were the first group of doctors who actually had to tarmac, looking for work, dropping CVs in all major and I'll say minor private hospitals. And that is a time when I actually discovered that Nairobi has very many private hospitals. I never knew, okay, I knew that there was the Nairobi Hospital, and then there was the Nairobi West Hospital. But there's also Nairobi South Hospital. And there was another, what I'll call a minor private hospital that was called Nairobi East Hospital. I never knew that there were these hospitals, but because we had to look for work, we tarmacked. We dropped our CVs in every imaginable hospital that you could find and trying to figure out, okay, what are we going to do this time? Because now you're out of internship, so you have no salary. Number two, you're looking for work, and all of you, as in you're all MOs who have just completed internship, so you're all at the same level. So there's nothing that's going to take you above your, put you above your peer in regards to any matters or anything like that. So we ended up dropping our CVs in very many hospitals, and then it took a while, and then we started getting slowly calls started coming in, calling you for interviews, and you'll go for an interview and then wait and see whether you'll be called back to be told you've been given work. So I was lucky enough to actually be the first interview. I did one interview at Avenue Hospital, and I was lucky enough to be picked to become a medical officer in Avenue. And I was actually happy because now at least I had somewhere to go. I had something to do. You can imagine being a doctor and you're sitting at home. Your skills and everything, you're sitting at home, which is, unfortunately, it's one of the things that's happening to several of our colleagues currently. It's not an interesting thing to be in that position where you have no work, you have no place where you can go and actually just keep practicing, because that's why we say medicine is a practice, because you need to be doing it over and over and over again so that your skills and your knowledge do not disappear. So yeah, so that's what I'm saying. In regards to financial prudence, the internship money that you get, my advice that I've been telling most of the guys I've been meeting in internship is, yes, enjoy yourself, but save money. Because you're going to need a buffer between that time when you're finishing internship and until you get your next job. And right now, the market is not as good as it was before. So there's a lot of things that are going on there that you can't be able to tell. So I stayed in Avenue Hospital for about 10 months, and then KNH did an advertisement for medical officers, which I applied for. I went through the interview process and everything, and then I got the call that I've been selected to join KNH, and I moved from Avenue to Kenyatta. The reason I did that was because at that time, there were certain advantages that KNH will offer me that the private hospital I was working, which is Avenue, will not have given me at that particular time. It was just basically a matter of choice. So as I was working in KNH, there are a lot of skills that I ended up acquiring, including focus. Focus is basically just point of care ultrasound skills. So I got into a program through KNH, which taught me how to do ultrasounds, also use ultrasounds for interventional techniques like fixing CVCs, fixing evidence for patients who are in shock, and things like that. Then I became a trainer with a team that you call Emergency Medicine Kenya Foundation, which teaches a course called the Emergency Care Course, and also got into a bit of research. And as you continued, as part of the things when I was put into the infectious disease unit during the COVID-19 pandemic, that also opened up some other opportunities, which I'll discuss as you continue going. So during that post-internship period, there's certain things that you need to look out for when you're actually looking for a job. So the first things, or the things that will weigh, if you do have the opportunity to have like two places that you're trying to figure out, okay, which side do I go to? Some of the things that you need to be looking at will be your working hours. What kind of leave days do they give you? What is your policy on working on during public holidays? Because you're a doctor. So it's not like all doctors go off on Christmas. There are people who have to work. And then what are my opportunities for growth? Is there sponsorship for MMed, or are there other routes in that particular facility that can allow me to grow in the field of medicine, whether clinical or non-clinical? So now, the post-internship life, basically, so as I was saying that you all come out of internship and you're all at the same level. So what are the things that I learned at that time was that, one, there's some skills that you need to get. And this one's like, you need to do your basic life support. You need to do your advanced cardiac life support training. You need to do your advanced trauma life support training, and your European or the pediatric advanced life support training. The reason I'm saying is because these were the things which were now used to, like, separate guys. So you'll be like 5 doctors who have applied for the same position in a particular hospital, but we have all applied, we all have the same MBCHB, but I have the advantage that I've done BLS and ACLS. So I'll have an advantage over my colleagues because these guys will be like, okay, this guy has at least done ACLS. So it'll be much better for us to, hire him because at least he can do something extra what the other guys can't. So this is also the money that you get for internship comes into play in regards to the savings that you do. So it's best to save your money and then pay for these courses. Because these courses usually, like for BLS and ACLS, I think minimum you can get them for is 18,000. ATLS, when I was doing ATLS, I paid about 35,000. And then I did my European Pediatric Advanced Life Support, which I paid, I think, about 27 or 30K. So you can see it's quite an amount of money that you need, because there's no, your employer will not pay for you to go and do these things. They'll actually ask for them as a prerequisite for you to be employed. So these are some of the things that you need to put a star on when you're doing your internship. Have this at the back of your mind. If the trainings become available during your internship, I highly recommend you to do them, because they will actually give you an advantage as you go ahead. So basically, that's what the skills that you have to offer and what sets you apart from your colleagues. Then the post-internship period was quite a difficult one. Okay, at first when you're doing the job search, because it's something that you never anticipated yourself to do. And so basically I'll call it crying in quotes. Then laughing emojis when you finally get a job and you're actually there working and you're doing what you love doing. You're doing the things that you're doing is your passion. You're enjoying your practice like that. And then also the other aspect of looking at, do you want to be in clinical practice, or do you want to go the non-clinical side? Do you want to go into research? Do you want to go into hospital management? Do you want to go into public health? And what are the opportunities that are there? Because not all of us can end up in a hospital to be treating patients. There are guys who need to develop the policies that we use in our facilities. There are guys who need to be in the Ministry of Health who are helping to create the policies and working around in regards to health matters and things like that. So there are also opportunities in those particular areas. And then let me talk a bit about opportunities in research. In what is tied now to the my COVID-19 experience. When I was moved to the COVID-19 unit when COVID-19 started, the very first patient who was confirmed to be COVID positive was a patient who were actually taken care of in our infectious disease unit. And from that time, when now COVID became a reality, that's where I noticed the opportunities in research came in. There is currently a lot of research that is being done around COVID-19 and in regards to infectious diseases. And once I got into that area, I realized that there are also there's a lot of opportunities in research. There are guys who have made the doctors who have made their careers in research. They have not gone into MED programs and stuff, but they just did research. And now the guys who are doing researches for WHO, they're doing research for all these organizations that are dealing with either infectious or non-infectious diseases, pediatric illnesses, etc., and things like that. So there's a lot of opportunities in research. And with those opportunities also, there's a paycheck that comes with it. So also it's an added advantage to get those things. So yeah, so you need also to look at, as you're doing your internship also, you need to try and see where you fit. Do you really fit into the clinical aspect? Are you what we call the traditional doctor who will either end up as a surgeon, a pediatrician, physician, or an obstetric gynecologist, or an emergency physician, all those things? Or are you the person who's more interested in, rather than being the person who impacts, rather than being the person who impacts one patient at a time, do you want to be the person who will impact like maybe 5,000 to 10,000 patients at a go? And that is usually found in the field of like policy making and research and things like that. Because if you do research and you develop a new drug or you develop a new concept, you have altered the lives of so many patients in one go. So those are the things that you play around with in your mind as you're doing your internship and trying to see where exactly do I fit in this medical world, and looking for those opportunities through which you can get to that point. Now, the options available or the opportunities available that I came to notice were, okay, the things that I can get, I came to realize were there. So the first thing is this: you can finish your internship and then you can wait for county governments to advertise, county governments and national hospital government or national hospitals to advertise for positions, and then you can apply. So you see, but that's a waiting game. And number two, you can apply to private hospitals for both permanent and locum opportunities. And then, or you guys can decide as you're doing your internship, the money that you're saving, you can come together as doctors and start your own practice. As medical officers, you are allowed to open up facilities. And one of the things I can say, what I have seen as an experience is that majority of, as doctors, we are taught to think big. So we usually look for major opportunities and say we need to come together and open up a whole hospital. But if you look at some people who have been successful in the world of entrepreneurship in the medical world in regards to opening up hospitals, they all started from a small facility. So like the owner of Roy Family Home, he started his hospital. It was just a room, basically just a room where he had a table, a chair, and a couch, an examination couch. That's how he started. And slowly by slowly, as his clientele grew, his hospital grew. Now the guy, I think, has like 4 hospitals that are interlinked with the Roy Family Home group of hospitals, like a group of hospitals or something like that. Yeah, so that's the thing. So knowing that we can actually start at that level, that we do not need to open up a fully fledged hospital with inpatient beds and all these things for us to say that, yeah, now we can actually do private practice. No, it can actually start with you coming up as a group of 2 or 3 doctors, getting a place, registering the company, and starting out. Just have a bed, an examination couch, an examination lamp, your desk, then your other equipments that you have, because the main instrument for you as a doctor at this particular time is your brain. And your other accessories like your stethoscope, your BP machine, and all those things, which are easy to get. And you can just start off on that level and then have the patience and the capabilities to watch as your hospital or your clinic grows into a hospital and continues up front. And that is a field of entrepreneurship, which I think I'll actually ask the organizers for this career talks. You can actually try and reach out to some of these doctors. And there are many. I can actually even give you the names of the doctors who have done entrepreneurship and have built hospitals that have been successful. And some have even been acquired by external companies. And these guys are doing quite well, so that they can actually give the guys who are on this forum a glimpse into what it is and what it takes to become an entrepreneur in the medical field. Then the other thing is you can decide to apply for your MMed program. If you've decided to do clinical work, you can apply for your MMed program as soon as possible. And the good thing now is that there are very many college, what we call college systems that are coming up. I know most of you have heard about COSEXA, that is the College of Surgeons of East Central and Southern Africa. And now we also have the College of Anesthesiology for East Central and Southern Africa. There's also the East Central Southern Africa College of Obstetrics and Gynecology, and also the East Central Southern Africa College of Physicians. Now, these college systems are the ones which train doctors to become specialists, but not through a formal MMed program. They have their own structures and they have their own recognition systems, where if you join, you practice as a physician, or you practice as a gynecologist or as an anesthesiologist. And at the end of it, you actually get your recognition and you actually become an anesthesiologist. It's a different path from the MMed program. And I think its cost is actually way, way cheaper than what you'll pay for your MMed program. But I think in Kenya currently, the one which has really taken root is the COSEXA, the surgery program for COSEXA, and also the anesthesia program. The anesthesiology program has also started. And I know of the East Central and Southern Africa College of Physicians has also started their program at Coast General Hospital and at the Moi Teaching and Referral Hospital. So those are other opportunities that you can look at. And then you can look at now non-clinical practice roles in the Ministry of Health, in non-governmental organizations. You can apply to do your MPH or your MBA in healthcare. So Strathmore University, or Strathmore Business School actually has several medical related courses, from an MBA in healthcare to how to manage a healthcare facility. They also have leadership in healthcare. They have a lot of programs that are medical related, but not clinical in nature. But for those people who may want now to just completely steer away from the clinical side of medicine. And then the other thing you can do at that time when you're still looking for something to do, you can become a teaching assistant. You can look for a position as a teaching assistant in a medical university or a college like the Kenya Medical Training College. They usually have these opportunities, though for some of them, they will ask that you have at least 2 years of post-internship experience so that you can come and now begin the process of becoming an assistant, then slowly rise through the levels of becoming a lecturer, etc., like that. So that's also a career path you can think about going through. So yeah, and sorry. Okay. Then the other one, which I think I'll also ask that this is another one which I think needs to be done as a separate talk, is now brain drain, leave the country. So you can decide to do your USMLEs, you can decide to do your field labs, or you can decide to go through them, what we call the membership of the Royal College Systems, which is something that is done in Britain. Now, for this one, it's quite an extensive talk. It's something that is so detailed. And I think for Nikita, if you can reach out, I can give you contacts for 3 doctors who I know who are always willing and ready to talk about the USMLE, the PLABs, and the MRCS program. And one of them is called Dr. Paul Yonga. He's a physician who took the route of the MRC, which is, he did the membership of the Royal College of Physicians. And right now he is a very, he's well versed in infectious diseases and travel medicine, but he's one of the really, really awesome consultants who always is ready to give talks about how to go through that path. What do you need? What is the cost implication? What is the like your mental implication? How much time do you have to keep? How much time do you have to put aside to read for these particular exams? So I will, I'll give you his contacts, and I'll actually reach out to him and tell him that you'll reach out, and then you can plan something, because this is one of the things that I actually feel will be even more beneficial for guys, especially when they're going through internship. But as you're doing your internship, it's one of the times where you can keep reading, especially for your USMLEs, step 1 and step 2, and also for your PLABs as well. Yeah. So as you're doing, because that time when you're an intern, you're always still reading because you're seeing new patients, so you always have to keep reading. It's a good time to just balance it out and do that. So that's why I'm doing that. This will require a separate talk, but I can help you guys organize and get Dr. Yonga to come and give a very, he has done very good presentations for this particular thing. So I'm sure most of the guys who are here will actually enjoy having that done. Yeah. So as you move on, the other thing was now the work-life balance. Work-life balance, what I came to realize was that work-life balance will totally depend on you. If we give my example, when I started working at Kenyatta, I realized that in KNH now I had more free time. Sometimes you'll find that in government hospitals, your working hours are 40 hours a week, which is standard for government. But private practice, private hospitals will now dictate the times. They can actually say you'll be working maybe 48 hours a week, 50 hours a week, depending on what they decide. And you see now you have to follow, because if they're your employer, you have to do it. So after I found that in KNH, I had more free time. So I started doing locums now at Avenue. So I would literally work myself to the bone. And at the end of the month, yes, you will see there was good money that was made. The bank balance was actually quite nice, but after some time you start getting the fatigue, and you realize that you can't keep doing this for the rest of your life. So work-life balance will depend on you and what career side you want to be. Do you want to do clinical? Do you want to do non-clinical? And what are the main things that are actually motivating you to go into either of those two career paths? For someone who, let's say, after internship discovers that, you know what, I really love my nights, I do not want to do night shift again, and I don't want to ever work over the weekend. Now, those are guys who probably go into non-clinical practice, and then that's where you can flourish. There are people who are in clinical practice who also can say that, but you can only say that when you become a consultant. As a consultant is when you can decide that, you know what, yeah, I'm never doing nights, I'm not doing weekends, I will be seeing my patients from Monday to Friday. Weekends in Izangu, I do not want to see anyone, I want to talk. And then, so the other thing that I've realized that has helped us cope as medical officers and as doctors, and most of my friends, that guys are now getting into hobbies and looking for things that are outside of medicine that gives them a thrill or a passion or something just totally different to do. I have friends who have taken up golf. I have friends who have taken up photography. I have friends who have taken up traveling as a hobby, and some of them are actually making money out of the traveling. There's a lady called Travel Doc who's on Instagram. She travels a lot, so she gets sponsorship deals and things like that. And that's the thing. So you need to look for something that is on the side that's not medicine related, that can actually give you, a bit more excitement in your life out of what medicine actually does for you. The fourth one I came to realize was the aspect of volunteering. Volunteering is something that's very dear to me, because I feel like it gives me a chance to give back to the community. And okay, when I'm working in Kenya, I'm also giving back to the community, but for that I'm getting paid. But volunteering, I'm actually giving up my time to go to the people who are not able to get to me for services, and we go and we do medical camps for them. So volunteering can come in very many aspects. Like for me, I am a member of St. John's Ambulance. I volunteer with St. John's Ambulance. I also volunteer with a group called Action in Focus and Healing Lives. And we usually go for medical camps with Action in Focus and Healing Lives to Masai Mara and to Nyeri County. And we also do a medical camp in Nairobi. Some of those camps were interrupted during the time of COVID because we could not gather, but now they're coming back into play. And I think these are some of the things that allow you to also, in a way, they help you to travel within Kenya. Like, I'll give an example. The Masai Mara medical camp that we do is usually one of the the most exciting things I ever look for. I look forward to every year because I know we'll go to Masai Mara, we will sleep in one of the Masai Mara areas because you have a lot of external donors who come in. So they pay off a lot of the things. We are not paid, as doctors, we are not paid, but they cater for everything, including transport, accommodation, and things like that. So in the morning when you're actually going to the venue of the camp, because the camp really lasts like 4 or 5 days. So every morning you go to where the camp is, you go to where the medical camp has been set up. So as you go to the medical camp, the awesome thing about it is that every morning it's a game drive for you. So from the place where you're sleeping to the place where the camp is, because it's quite far. So you have to traverse through Masai Mara and you actually just go in, seeing lions and whatever, and then you go and you offer your medical services to people who would not be able to get to PNH to get those services. It's a very, very nice feeling, something that enriches you as a person if you feel like that's the path you will want to take. Yeah, so that basically on volunteering. Yeah, I really hope I've not spoken quickly. I sometimes tend to speak really fast. I've been told that several times, but in case of anything that I did not maybe mention, or yeah, we can go through to the questions, and I'll be happy to answer the questions to the best of my abilities. Thank you so much for giving me this opportunity to share this. It's awesome. Thank you so much. Yeah.
Thanks, Dr. Mutua. That was a fantastic presentation. I feel like you are telling us a story and not just making a boring PowerPoint, as we're so often treated to during our online lectures. So we have one question in the chat so far. Guys, feel free to post your questions. Meanwhile, I'll also engage you with a couple of things that I had noted down while I was listening. So the first question we have is from Ndong. Can someone get into research directly without doing internship?
Okay, no, that one will be a bit difficult. Internship is one of the requirements for you to register as a doctor in the country. So it's one of those things that you can't escape. Unfortunately, you must do internship, because now once you do internship, then now you're registered as a medical doctor, and then now at that point now you can go into research, because without having done your internship, you're not recognized as a doctor in the country, and it will be very hard for someone to offer you a research position, especially for areas where you're becoming like the principal investigator or part of the investigators. It's very difficult for them to give you that if you don't have the papers. And not really at the papers to show that you've done research, but basically, are you registered as a medical doctor? That is one of the things. And part of you to be registered as a medical doctor, you definitely need to do it. Yeah.
Okay. And on the same note, I was once told by a professor who works at Kemri that they get very excited when they see young doctors getting into research, instead of going the route where you do your MBCHB, then you do your internship, then do MMed, then go into research, because in that, it's good because you bring a unique set of skills as a consultant, but your process of thinking has kind of been formatted in a very clinical way, as opposed to when you go directly into research. But directly here means, as Dr. Mutua has said, it means that you do your internship, then get into the field of research. So I hope your answer has been adequately
maybe they can add, yes, with Kemri, especially, I've seen very many of doctors who have finished the internship and then they joined the Kemri Wellcome Trust Foundation or the Kemri group, especially because I've worked with them, I worked with some of them during the COVID-19, when we were doing, there's a research we were doing with them, with Kemri for COVID-19 antibody testing. And I noticed that most of the doctors who work there, majority of them actually they were medical officers who finished internship and went straight into research. And now they're actually growing in the field of research. They're not doing MMed, they're not doing those things, but in regards to research, they're getting projects, they're getting work, they're getting funding. It's actually a very exciting field by there. If you're one of those people I just want to have my 9-to-3 job, have my weekends with my friends, such things, yeah.
Yeah, so there you go. A question from Castro. UN allows balloting for internship centers. From your experience, would you advise one to take their internship from a well-established city hospital or from a remote center? Yani kwenda mashinani ama you stay around Nairobi?
Okay. Well, that one I think depends on what you want to do. So they usually say that mashinani hospitals tend to offer the best experience for you as an intern because you get to be there one-on-one with the patients. The flip side of it is equipment, medications, and things like that may not be there. So you'll be having a hard time in regards to how you're going to take care of these patients. Now, the flip side, if let's say you do an internship in KNH, you have access to everything, but now you have your registrars, you have your junior, you have your fellows, the fellows are guys who are doing their fellowships, you have your consultants, etc. So if you're looking for something that will give you that, let's say like practical experience like in surgery, in KNH, it might be difficult because you have the registrars who also want to be in theater and actually do the actual surgeries. But if you take it to Mashinani, and then now you find it's only you and the consultant. So if the consult decides, yeah, we're going to theater, they're going to theater with you. You're going to be there. You're going to be a second assist. At times, they're going to actually tell you, by the way, you're the one who's doing this case. I will be here. I will observe. In case of anything, I'll jump in. So you'll get that experience from those hospitals. For my experience, like I said, I did my internship in a Chak hospital, Tumutumu. And my experience was, okay, totally, for me, my internship experience was amazing because I had an excellent set of consultants. I had medical officers who were very dedicated to their job. I would call them even at 3 a.m. in the morning and guys would show up. And the consultants that we had a very nice teaching system where, if I take an example like obstetrics and gynecology, my consultant in Obsgyn, the first 2 weeks of the rotation, he was there with us every single day. He showed us how to do a cesarean section from the skin incision, taking a step by step by step up to extraction of the baby, then closing the uterus all the way up for 2 straight weeks. That's what he did. The third week, it was now us. He was there at the corner and he's telling us, okay, guys, do your thing. And then he sit there and you just watch. If you run into problems, he's there, he'll come and tell you, okay, fine. So here you're supposed to do this, you're supposed to do that. Now, the essence of him training us like that was that by the time we were getting to our 4th week of our, as in once the first month was done in our rotation, the next 2 months, we rarely disturbed him. We rarely called him because we were able to actually handle most of the cases that were coming in because he had taught us how to do that. And that was the thing with even the other departments, it was the same thing. I'm saying that, so in public hospitals, I don't think that is there per se, but you never know. There's some consultants who may decide, you know what, I want to teach. I want to show these guys how to do the right thing. And people are there and they'll actually teach you and yeah, and learn. So that was my experience.
So what you're saying is Chak hospitals, at least the one that you went to, it gives a nice balance of being hands-on, but then also learning best practice. And they have equipment, so it's not like you'll be at a loss for what to do. You know the theory, but how is it to
that is true. The Chak hospitals tend to have a very intense internship program, but when you come out of there, you've learned a lot. As in your practical experience and the things that you do, you really can't compare with a lot of the public hospitals. And because there you have, unfortunately, one of the things that most of my colleagues had complained about, the ones who had been in public hospitals at that time, maybe things have changed. They used to say that it was very hard for them to get consultants. You've had these horror stories where you're stuck with a patient, you're calling and the consult is like, me, I'm too far away, I'm not coming. You do what you're going to do. And you're like, okay, fine. You call the MO is like, hey, by the me, I'm not even in the area I've left for Nairobi or something like that. So I think now because of the structure of Chak hospitals where the consultants must be available, the medical officers must be available because they're also held accountable. So you get to learn properly, as you get to learn how to do things the right way.
Yeah. Okay. And what do you have to say about private hospitals, internship in private hospitals?
I can't really say much because I've never had the experience. Even my colleagues at that time, I didn't have any who actually went to a private hospital. The one I know that guys have really said that actually has a good internship program is Aga Khan. I am not sure about, Aga Khan. I'm not sure about the others like MP Shire and Nairobi Hospital. So I can't really comment much on that.
Okay. So, and I hear that people take a pay cut. The interns who go to private hospitals really take a bit of a pay cut. So maybe that's something to consider because one of your points and the internship section of the presentation was money management.
Yeah. Well, for Chak hospitals, okay, let me tell you what. So my experience in Tumutumu was this. So we were still paid by the government. And the good thing about Chak hospitals was, one, they gave us free accommodation. And so I actually had my own house, which was like a 3-bedroom house for just one guy, which Yeah, and then there was food, so I didn't have to cook. The hospital is just there, so I'm not incurring any transport costs. And then the hospital itself will pay us a stipend at the end of the month. So there was like an additional amount of money that was paid to us as a stipend at the end of the month. So it was good. Let me just say that it was good.
That's good. That's good.
Yeah.
So finalists can take these points into consideration as we figure out where we're balloting for. We'll probably have to talk to someone who's going to a private hospital as well and get there. I think that's becoming more common, especially for students who are not Kenyan nationals. I think at some point they had to apply for internship at private hospitals. Anyway, so enough about internship, unless there's another question on that. We move on to a question from Ray. Are guys in MEd paid a salary?
Well, that question is interesting. So, so guys in MEd, unless you work for a particular county that has released you for MEd, because that county will continue paying you your salary. And then the national government is the one which is supposed to pay your school fees when you're doing your MEd. But now, with the current situation where majority of counties are not willing to release guys for studies, though the union, the Kenya Medical Practitioner and Dentist Union, is really fighting very hard to have this thing changed. You'll find that the people who are not, counties are not releasing people to go to school. And for those ones who are now coming as what we call, if you come and apply as a private student, you have to pay the school fees. But like if you're doing a master's in KNH does not pay you a salary as a resident, because you do not belong to KNH. You belong to University of Nairobi. So they're not usually paid. The only place I know where, the one that I know where MEd guys are paid is Aga Khan.
Yeah.
Aga Khan pays their residents, though there have been complaints that the money is not at a lot. But at the end of the day, when you think about it, you're getting a salary and you're getting a master's at the end of it. There's really nothing, you can't really complain at that point, seriously. Yeah, you can't really complain. The other programs like the COSEXA programs and those ones, they don't pay unless you're, like there are centers which are, let's take an example of COSEXA centers. If you're a medical officer working in Kiambu County, and Kiambu Teaching and Kiambu level 5 hospital is a COSEXA training facility. So if you're in Kiambu County and you're earning a salary, you can actually apply to do COSEXA in Kiambu. So you'll actually still have your salary and just doing your COSEXA program at the same. Yeah, so that's it. So not all MEd guys are paid a salary. Yeah, there's some who survive on locums. It's a tough world. It's a tough world. Yeah.
It is, especially with the raise in fees.
Ooh, it's a tough world. Yeah.
Okay, a question from John Chul. Would you advise one to do the internship in a public or private hospital? I think we're given enough pointers on pros and cons of both. So we can move to the next, unless John wants an answer. Unaweza kuandika kwa chat box, but unless you really want an answer to that, let's move on to the next question. That's a question from Ray. A continuation. He had asked, are guys in MEd paid a salary also in COSEXA and other colleges? So
I think I've said that on for COSEXA. It depends. Yeah. If you work in a particular county and the county referral hospital is part of the COSEXA training accredited institutions, you might actually be lucky that you'll be getting a salary from the county and you're still studying your COSEXA program. But if you apply for COSEXA, let's say in MTRH or in KNH or in other hospitals, you may not get paid. Though I have a colleague who's doing his COSEXA in Mata Hospital, and they're actually paid because they actually do the work. So there's a payment for them. I think some of the private hospitals that are COSEXA accredited actually pay a salary for the guys who are actually doing COSEXA programs. But I'm not sure about all of them, at least for Mata. I think I know that they are paid. Yeah.
A question from Castro. Which is the best time to do BLS, ACLS? You had also talked about ATLS and EPALS. What's the best time to do them? Is it during undergrad training or afterwards? And does the time make a difference to the preference of a potential employer?
Actually, yes, it does. I would advise to do your BLS ACLS trainings either during internship or after internship. You know, they're usually timed. They are for a period of time, so you have to renew them after some time. I think for ACLS it's 4 years, ATLS as well. The others which are 2 years, so you have to renew after every 2 years. You have to renew. So the best time to do them will be either during internship or immediately after internship, so that now you can use them now to. If you're looking for work, you can ask for them. Now, what happens like for us in KNH, when we applied, we actually asked for our ACLS and BLS qualifications or certifications, which we give. And then now, as you're part of the hospital, at least the good thing about KNH is that we have a training program where these trainings are usually done. So when your ACLS is about to end, you just when another ACLS program is being done, training under KNH, you apply, unapewa, and then unafanya. Yeah.
So I like that there are some organizations that have been making these trainings available to students at subsidized prices. So guys, take advantage of that. When your class reps and your external affairs officers post things in the group, don't just scroll through. Some of them are very good deals. So it doesn't hurt, at least for BLS, it doesn't have to start now because some of them are really basic life support things. Can be at a party when you're medic hapo. Even if you're a third student, mtu anachoke na ujui kenye utafanya. So yeah. So anyway, that's an answer to Castro's question. We can move on to the next one, which is since KNH is under national government, does it pay the same amount as the county hospital? And what are its benefits compared to county hospitals?
Okay. Okay, I don't know how much county hospital doctors are paid, but KNH has a very competitive salary. We get paid well, if I can say so, according to the structures. But now with what KMPDU has been doing with the collective bargaining agreements, so these things have been harmonized. So you'll find that at some point the payments will not be that big. There'll not be a big difference in regards to whether you're in a county hospital or you're in a national hospital like KNH or MTRH. The thing about benefits compared to county hospitals. Okay, one, what I would say is at KNH, at least we have the capacity and you have equipment, you have consultants, you have subspecialists, you have all these people. So it feels very nice to work in such an environment where if a patient has, trauma to the chest and requires cardiothoracic, there's a cardiothoracic surgeon available. If they're head injury, they need a neurosurgeon, there's a neurosurgeon available. County hospitals, on the other hand, these subspecialists are not there. So now they have to refer to clinic for those patients to be taken care of. So I can say that's one in terms of patient care. In terms of welfare and working environment and working hours and things like leave days and all that, I think they're pretty much the same for all government facilities because we get 30 leave days in a year, and those are 30 working days. So they just count Monday to Friday. They don't count weekends and they don't count holidays. Then for public holidays, like for KNH, if you work on a public holiday, you get compensated with 2 days, things like that. So yeah. So it just depends on those, like I was saying, when you're looking for a job, there are some of those nitty-gritty things that you need to ask for. Sometimes remuneration may not be your only motivation, because you can go to a hospital and they tell you, we will pay you 400,000 Kenya shillings a month. But then you realize you're working almost 60 hours a week. As in, by the time even the weekend is coming, you are so drained. Even by the time end month gets there, even when you get that salary, you do not have the time to even use it. So it doesn't make sense. There are other places where you'll find that they will tell you, okay, we will pay you 200,000, but you will work 40 hours a week, and you have this number of leave days, you have this number of off days, and there's some other things, and then they can tell you, we have training opportunities, we can train you, we can increase your skills, we can, if maybe that point comes to, we can decide to sponsor you for your MED and things like that. So there are other incentives that you can look for other than just the money. So there are other things that you can look for on the side. Yeah.
As the talk is going on, I'm getting messages in the chat box as well as texts from some classmates saying they're realizing working in Kenya is actually not as bad as the horror stories make it seem like. So that brings me to the point of brain drain. you had brought it up as one of the options. Leaving, I think, is a good option if you get into a good program outside. And just to point out that we have a repository of recorded videos that we had done. We had started doing in 2021 with Amsun. We engaged different doctors from, I think, 5 countries. So Dr. Mauga, that's not his name, oh my goodness, the pediatrics lecturer. This is on
Dr. Maugo.
Yes, Dr. Maugo from Canada. Let me just not say people's names. And there was a doctor from the UK, there was one from the US, one from Australia, one from South Africa. So I like that you had plugged Dr. Yonga. Is someone that should come and talk to the students. And we would be happy to keep growing that repository because as much as one person's story opens your eyes to the opportunities in a different country, they might have had a different experience from someone in the same country. So if you have more contacts to give us, please share. We'd be very happy to. Yeah, so that's an option that I think a lot of people were considering last year. Tukisikia stories madaktari hawalipwi nini nini. So thanks for encouraging.
No,
people.
Those stories are there. Those stories are there, especially with counties. There are counties that, for some reason, just delay people's salaries for, you don't even know why. As in, see, there are places where I know guys who have stayed like 4 or 5 months without being paid. And you wonder, okay, how are people surviving? I think on my part, I may have been fortunate enough to always land on the good side. Because if I give an example of my employer, KNH, we always know at the end of the month, our salary will check in, regardless. And our salaries will check in. I think that's one of the things that the management has ensured, that they will not mess around with people's salaries. So we always know that Ikikaribia, like today is 29. So I'm sure next week, is
smiling.
yeah. So my bank account might smile a bit. So that's the thing. There's some places that one in private pay guys on time. Because for them now, it's now their prerogative that, we're supposed to pay guys on this particular day, so they will pay. County governments, I think, just because of the internal politics and how money is used in those places, there tends to be very many horror stories coming out from counties, coming out from doctors. There have been so many county-centered doctors just because of things like promotions, salaries, and things like that. So the doctors were actually going through those horror stories per se. So I will not be surprised when people say, you know what, we want to leave the country. This is what they're for. And the funny thing is that you'll find, like in the UK, they're actually looking for doctors. As in the NHS system is actually, I've been seeing those reports, and they're saying, the NHS is actually literally on the brink of collapse because they don't have doctors. So they're looking for doctors. And if you're here in Kenya and they're taking doctors from Kenya, from other African countries, Nigeria, India, all those places, why not? Because they know, like, for now, they've actually brought in the, what is it called? The PLabs center has been moved to Nairobi from Sudan, because Sudan is very volatile. So now guys can actually do the exams here in Nairobi. You don't have to go to Sudan. Yeah, as in those are some of the things that have actually happened, and you're like, wow, this is cool. And like for the things like for membership of the Royal College of Physicians, and the Part 1 exams, you can actually do them at Aga Khan. You don't have to go. You don't have to go to UK to do them. Now you can actually save money, and then I'll plan for doing like Part 2. Yeah, as in things actually, pole things are getting better. Yeah, so opportunities are there.
Perfect. So I've just noted that the time is 6 p.m. This talk was supposed to be from 5 to 6. If we're nowhere near done, so I'm ready to go on if you are.
That's fine. That's fine.
40 minutes, and then we try zoom through the questions.
Okay.
So for those of you who had other engagements past 6, feel free to leave, but I suggest you stay. This is a very informative conversation. Right, so we had got to the question from Faisal. A question from George. Besides being equipped with knowledge, which other skill sets do you essentially need to navigate through your internship period?
Internship period, basically, I think that's, you just need your knowledge, because now internship period is where you're actually going to learn. You're going to learn and perfect your skills. All these things that you've been doing in ward rounds, like listening to a patient's chest and trying to figure out whether that is a mom or not. Now, those are the things that you're going to actually now cement in your internship. So you just need your basic knowledge, you just need your MBCHB knowledge. And then now, as you go into now dealing with these actual patients, that's where now your knowledge and your skills now begin to grow. So that by the time you leave in internship, you're ready now for the post-internship period now when you come now to actually work as a medical officer. Yeah.
Sawa, a question from what's the requirement to get MEd admission in UON as a government-sponsored student? And I'll add on to that question. Is that still happening? That's been scrapped.
Yeah, that's the question. Is it still happening? So government-sponsored became very tricky because of the county systems. You know, before counties happened, it was just national government. So national government, you'll apply and then you'll be sponsored. But now guys are actually going as parallel students, and unless your county releases you, as in your county releases you to go for a program, that is when now it can be sort of considered like government sponsored, because you're coming from the county to work either at MTRH or at KNH under University of Nairobi and Moi University as you're developing as a specialist. So the thing there is really that the county will continue paying you your salary, and then government will now pay your tuition in school. But for guys who are like private sponsored, that will pay to school fees and figure out how you're going to navigate through. But your government sponsored has become very, very tricky these days. Very tricky.
I had someone mentioning that there are students who are very good at looking for scholarships, even in the postgraduate section. Yeah. So the hike in fees from 200K to 648 was just like, let me look for Bamburi cement or something. So going in as a graduate student is an option.
Yeah, but I think even Ministry of Health has been rolling out some scholarship programs. Yeah, I think they recently advertised one. Was it last month or the month before? Yeah. So I'm sure if you check the Ministry of Health website, you'll be able to see them. So there are scholarships and sponsorships available.
And another question from me, now that you've talked about looking for sponsorships on the MOH website, where do people look for jobs? Is it typically LinkedIn, word of mouth, the newspaper, as Dr. Natafutanga wapi, ama ni kujuana?
All those things you've said.
Okay.
All of them. So counties advertise in newspapers, and for even hospitals like KNH, they do the same. They just publish them in the newspaper. So you just see them and then go, oh yeah, there's an advertisement, send in your application documents, and then the process flows. There are other places like mostly private facilities where it can be word of mouth. Like I can recommend you for a job at a particular place, and then based on my recommendation, that will give you the job. There are LinkedIn also has actually helped, I think, though I haven't really updated mine for a while, I need to do that. But yeah, LinkedIn also provides some opportunities mostly for private hospitals and stuff. Sometimes you actually go through LinkedIn and look for, you can do a search on LinkedIn, just go like medical officers, and it will bring you a list of guys, and then just go through them, looking at their profiles, and you're like, okay, this one looks like they can reach out to them. Yeah, so we have this job, Nini, do you want to come? Yeah. So that one.
Approach people.
Yeah?
They approach people directly sometimes.
Yeah, directly.
Wow.
Yes.
So this is a guys, this is a call to get on your LinkedIn profile and work on it. See your Instagram kila siku. So we have a question from Nyakio. Is it possible to start volunteering as a medical student, even though you don't have much experience?
Yes, it's possible. Join St. John. It's very, very possible, especially as a medical student. By day, it's something that you can do. You can join, especially in St. John, you'll get opportunities to be trained in BLS and ACLS, and then you can actually become a first aid trainer. So you're already starting to get money on the side as a trainer, kidogo. Though sometimes St. John doesn't really pay guys that much because it's a volunteer organization, it's a not-for-profit, and etc. But yeah, it's good to start. The earlier you start, the better. There are opportunities available. So I think I'll just check my files and see which opportunities are available for volunteering for guys who are still medical students. Then I can give feedback. I think, Nikita, you have my number, so you can just remind me over this week. I can just, have a look and see which opportunities are there.
Okay, thank you. And to add on to that, it's also important to join if you're interested in volunteering and doing extracurricular activities, it's a good idea to join school clubs. You'll find that they have partnered up with local organizations or even international ones to put together medical camps and little events like those where you start building your volunteering profile. So External Affairs Amsun has a list of clubs that medical students can join. So look into that. That would also be helpful, but I will follow up on the list from Dr. Mutua and share it with you guys. So do you have a question from L? Guys, remember to put your 2 names in your Zoom profile. Do you have any tips for getting into a faith-based hospital for internship?
So faith-based hospitals usually have, what are they called? Interviews done.
Mm-hmm.
Okay, so like the time when I did my interviews, the process at that time, it may not be what is going on right now, but I think it's probably the same. We had to apply through CHAC, and then there's a form you download from their website. Then that form now gives you the list of hospitals, and then it tells you to choose. So you can only choose 2 hospitals, one as your first choice and one as your second choice. Then they will tell you when the interviews are going to be held. So you present yourself for the interview, and then it's not an exam, it's not a written interview. It's more of an interview where they just sit with them. You sit with them and they just ask you questions, random questions. They ask you about your faith. They ask you about what your experience in medical school is like. Okay, those are the questions I was asked. And then they'll ask you like one medical question or a surgical question, like how do you manage myocardial infarction? And then you just mumble some answers there, like, yeah, I know this oxygen and morphine and stuff. And then, okay, fine. So they'll have like one clinical, because for me, like they ask me just one clinical question. The rest of the questions are just, they want to get to know you. As what's your faith? What is your plan after internship? Such things. Yeah. So there are those organizations that, okay, in CHAC, there are those ones which are very strict on the Christianity aspect. So they will want, part of the requirements that they ask, will even ask for a letter from your priest or your pastor. They ask for recommendations from like even the Christian Union and things like that. So they ask for such things. Yeah, then you just, depending on the 2 choices that you made, you'll be interviewed by both panels of those 2 institutions. And then if they feel like they like you and they want you to be part of their team, they actually send you, because like I got my letter even before we did our final exams. By the time we're doing our final exams, yeah, I already knew I had an internship spot. So it was just easy. I was just like, yeah, I'm good. Yeah, you all guys are going to go and ballot and I have my letter. I'm good. Yeah, so they gave for the guys who got a check from on our side. Basically, we got our letters even before we sat for our final exams.
Okay.
Yeah.
So they come to the university and let people know that they're going to be conducting interviews to interested students. Where do we begin?
You begin at the CHAC website.
Okay, I see.
Yeah, just CHK website, and then after that, they'll tell you all those things. The dates are usually preset. So, yeah. And University of Nairobi is one of the major contributors for CHAC, guys, by the way. Yeah, you have very many people from UN who have actually gone through CHAC. So, University of Nairobi is used as one of the examination of the internship of the interview centers. Most times they'll use University of Nairobi, they will use KU, and sometimes they can decide to use Egerton University as well. And I think also in Eldoret, but on different dates. So it's for you now to decide when you want to do your interview. So they'll tell you, we'll be in Nairobi on these dates, we'll be in Eldoret on these dates, we'll be in this place on these dates. So depending on you, you can decide, okay, fine, I don't want to do my interview here, let me go and do it in Eldoret. Yeah, so you can do that. But just check with the website. I think they'll have more up-to-date information.
Okay. So a question from Nyakio Wehumbu. What did you mean by the wandering doctor? That's a Instagram handle. There's a doctor.
Yeah, she's on Instagram. She does a lot of traveling and stuff. So it's one of those accounts that just follow you. You're like, wow, this is a doctor and she's doing all these things. She's on which place, Masai Mara, where, as in. So you just come to realize that there are very many doctors who are doing so many things on the side. There's a doctor I know who's currently doing his MEd in ENT, but he's a DJ. And, and he organizes events. Yeah, Domino Entertainment. And then they organize events in the bushes, usually go and have fun, those sides. And, these are actual doctors.
Okay.
Like, okay, this is interesting. So that's what I'm saying. As in, get something else on the side that is not medicine. It helps you balance. And the thing is, with doctors, we tend to, our conversations are usually the same. Wow, I had this patient. Wow, alikuwa na sijui, he had a knife sticking in his neck, and he was, and at that time you're talking to people who are not even medics. So sometimes you also need to have things on the side that can allow you to have decent conversations with other people, so that you're not always just talking about this patient, or even when like you're two doctors and then you meet a group of other people and then your stories are just clinical. You're just like, I had this patient and then this patient did this and then that, and let's look for hobbies.
True. It's important to be an interesting person, not just an interesting doctor, because his life outside of MH2 and LT3.
Yeah, that's very true. That's very true. Yeah.
Yes. Okay, so next question is it possible to do both research and clinical work after internship? That's from Ron Collins Morioki. If so, what does that life look like?
Yes, it is possible to do clinical work and research after internship. So I'll give an example. Like when I was in the infectious disease unit, when we're dealing with COVID-19. So I was dealing with both the clinical aspect of dealing with COVID-19 and also part of like 2 or 3 researches that are ongoing currently based on COVID-19. So it is possible if it's something that is within the line of where you are. If you're, let's say, if you're doing like your MMed in pediatrics, you can actually be part of researches that are dealing with PIDS or conditions that deal with PIDS. So it's very possible to actually have both clinical and research working simultaneously at the same time. If you get the opportunities, yeah, definitely. It takes a lot of your time because you still have to handle your clinical duties and then you still have to work on the research. It does take a lot of your time, but sometimes for people, just you can sit and decide, you know what, it's worth the sacrifice. I'm going to do that. Yeah.
And it's something that you can start doing as an undergrad. I think people chanukad and broke through the barriers of having BSc anatomy and your students being the only researchers in med school. We have REMED, that's research in medicine, which is a peer taught program where we have students who are experienced in clinical research teaching other students how to do the same thing. We have the medical research club, I think. I hope I got the name correctly at UN. We have a couple of them going on. So don't think that the time is later. The time is now. If you're interested in research, Ron Collins and other people, just start.
Yeah.
Talk to your classmates who are already have their toes dipped in the pool.
Yeah, you can look for Castro. We were doing a research with him on trauma, focus for trauma patients. So yeah, should be your link person.
Yeah.
So okay. So
next question. Can someone who went through COSEXA be recognized like any other doctor? That's from Cheres Amos.
Yes, actually, there had been that debate before of whether these guys are actually real surgeons and etc. But at the end of the day, they are actually surgeons and they are recognized. And I think the only difference between them and guys who have done MMed is the research part. I think more of that research part, because I think COSEXA is mostly for guys who want to purely do surgery. They are not interested in like becoming lecturers or to teach students in university where they need to actually have an MMed or they need to get into research. But if let's say you're the person who your passion is just surgery and you just want to operate on patients, that's it. You don't want easy vitu zingine. You just want to come, cut, open, repair, shona, maliza, umenda. That's it. That's all you want. That's it. Yeah, COSEXA now is widely recognized. It has very many subspecialties. You can actually do the COSEXA because it's usually a 5 or a 6 year program. So the first 2 years, they do what is called the membership of the college, which is just basically general surgery. So you do 2 years of general surgery. Then after that, the 3 or 4 years that follow, now it's for you to decide whether to do neurosurgery, pediatric surgery, orthopedics, gen surg, plastics and reconstructive. They have almost all the subspecialties. You won't just be purely that. Yeah, and you'll be fully recognized by them.
Okay. So From Fred Kamau, how do you balance life so that you can grow at the same rate financially, socially? He asks this because most doctors realize late that they spend much time with patients to a point where they forget their families, whether they have them or they want to start them. And then a second question from Fred, do doctors have a circle? I'm seeing someone had answered KMA circle, but you can tell us if there's more.
Yes, there is. We do have a circle. It's called Kenya Medical Association circle. Yeah, it operates like any other circle, and it's a good way for you to save your money. Actually, I'll advise guys when you start internship, join the circle so that you can be saving your money there. And then it gives you a lot of opportunities in case you may need to get a loan, maybe to start a center or a facility. And they're actually very nicely structured, and they do well. Now, in regards to balance, work-life balance, financially and socially, it's true. You just need to, I think it's something that you need to figure out. I know of I've heard of some consultants who are very strict in regards to their time. They even tell their clients that, I am only available from Monday to Friday from 9 to 3 p.m. If you call me after 3 p.m., I will not pick my phone. So if it's an emergency, take that patient to the hospital. So sometimes it comes down to your personal decision. It's you to decide, this is my limit, this is where I want to stop. Unfortunately, the people who have been there before have been in the rat race. The plan had always been, I finish med school, I work, I go into MED, nimalize MED, I get admission rates at Nairobi Hospital and at Nairobi West, and then I get employed in KNH. Hapo sasa niko sawa. Because I can see my patients in KNH, become a lecturer in UN, see patients in Nairobi Hospital, see patients in Nairobi West. So you're always crisscrossing Nairobi. You're always driving from one end to another. So by the time, and for one thing I came to realize is that the money will never be enough. It will never be enough. You will chase it until, but it will never be enough. But I think it's something when you can consciously look at your life and say, this is my limit, because I want to work for my patients, but at the same time, I want my family to know. I want to have, my kids should know me that I am there, not just knowing that mom or dad is a doctor, so they're always away. They're always away. They're never there. So, like I said, for that kind of balance, it's a very, very personal thing that you need to sit down and analyze. What are your goals in terms of, what are your financial goals, first of all? What do you want to achieve in the next 5-10 years? Do you want to build a house? Do you want to have a family? Do you want to do this? And then sit down and look at it and say, okay, for me to do that, how much money do I need to have? Then work on it and see how I can get this money now so that I can be able to live that life at this particular time that I want to live it. That's basically what I can say for that. Yeah.
Okay. So ni venye utajipanga, and like we hear a number of registrars and MOs saying, don't do locums, especially without a goal in mind, because you'll just keep, you'll stay in that race forever.
Yeah. For us, the locums you were doing, they always had a goal. So you'll sit down and you tell yourself, okay, I need a new TV. This TV is going to cost me how much? 80K. Okay, sir, how many? Okay, my locum hours, I'm paid, let's say 1,000 bob per hour. So that's so many hours, I have this number of hours. So this month, I will do this number of locums. Do you pesa kingia tu hivi in industry kununua TV nimemalizana na hiyo. So it's good to always have that a plan, especially, it's very true, especially for locums. Because you just end up doing locums for the sake of doing locums. It doesn't make sense. Yeah.
That's true. And on that note, I'll break the order in which we've been taking the questions, because you talked about being doing locums and being a registrar or a consultant. And I think I saw someone asking, it's Hanif, what's the scope of being just a medical officer, since many are taking the route of MED?
Okay.
How is it if you don't specialize? What's that like?
Okay, if you don't specialize, so guys have this quote, okay, like a name, they call it chronic MOs. You just become a chronic MO. The thing about being a chronic MO, especially in the clinical field, is that you will not grow. There's a point where you'll reach, you'll stagnate. That will be the end, especially clinically. So you'll find yourself, maybe you're always just in the outpatient department, so you'll always be seeing the same cases day in, day out. You'll find yourself, maybe let's say if you're in KNH, you'll find yourself maybe in the accident emergency department forever. It's there. You're not moving away like that. but your scope is still the same. You're still going to see patients, but there's a point where it will reach where there's a ceiling. There's a ceiling to that. There's a point where you can't break above that unless you do an M. Or you can decide to go now the non-clinical route. You can go into research. Research is a lot of. You can go into healthcare management. You can go into public health. There's a lot of from that side. Yeah. Because slowly by slowly, that in clinical aspects, the part for MOs is getting smaller and smaller. Because everyone who's becoming an MO is doing an MO for like just maybe 2 years, and then they're off to do their MMeds. And so now our population of specialists is growing. Our population of MOs who are down here is actually just narrowing. And then you have the base, which is now the interns. So it's like a big pool. Then you come reducing as MO, then specialists even. Yeah. But there are people who have remained chronic MOs. But from my personal experience, I've seen the majority of the MOs who are thriving, actually the guys who have now moved out of the clinical practice, guys who are going to pharmaceutical companies and becoming medical directors or medical liaisons. And that's actually one of the really nice jobs those guys are doing. Those guys work like 3 days in a week, Monday to Wednesday. And then their salary is way bigger than mine. And they're always traveling. I work for Sanofi. It's called Sanofi. Yeah. Sanofi. And someone is just there. Is like, oh, I've gone to France. Oh, so there's a meeting, and then I'll be back after how long. Such things. Yeah. So there are those opportunities. Mostly, if you move out of the clinical, if you're an MO and you move out of the clinical side, there's a lot of opportunities on this other side, on the non-clinical. But for some of us, the clinical life is actually quite nice. Yeah. It's nice when you see, it's nice when you see you've sorted out a patient and you see them waking up. It's a very nice feeling. Yeah. Yeah,
I guess it just depends on where your interest lies.
True. I'd like to. Also, let me just answer plus one of the questions in regards to online doctor consultations.
Yes.
Yes, those things are there. The apps are there, and there are people who are, and that field actually, it exploded during COVID-19. I know of MOs who were working in COVID centers, and then they decided, you know what, we're going to be doing house calls for COVID.
Yeah,
and true. You're going for a house call, and you're charging 10K consultation, and guys are paying. And that time, in a week, you're seeing almost like maybe 3 to 4 patients in a day for 5 days in a week. And guys were making, not that guys were making money, they are making money even now. So, especially in Nairobi, in urban centers, guys have actually opened up to that aspect of having the doctor come to you rather than you going. Yeah. So online doctor consultations, another field you can venture into. And even concierge, it's called concierge medicine. Yeah. Go to the houses, see people in the houses. These guys who have chronic illnesses like hypertension, DM, they don't need to come to hospital. You can go see them, buy a stethoscope, buy a BP machine, glucometer. Tell them, I'll be seeing you every month. We see how things are going. We have a very nice schedule for you. We know, we check your BPs, we check your sugars and all these things. There's a doctor who actually has a company that does, Dr. Rowena Njeri. She has a company called Zoya. Yeah, and it's basically, that's what they do. They do home calls. They do house calls for patients. So yeah, these opportunities are there. Yep.
That's true. I just wanted to, I forgot to mention that Keme Sako is also open to students to join. Medical students can join the Sako. You just need a recommendation letter or recognition letter, I don't know, but from a department in the School of Medicine or from the Dean's office, just to ascertain that you really are being trained to become a medical doctor. And then you join, I think 2,500 or something like that. The amount is not too crazy. Yeah, and I think something attractive about it is that you can take a loan, so to speak, that's sort of customized for that internship period for the first few months where you don't get paid before the boom comes.
That's true. Yeah.
So you guys might want to consider joining that. Let's see. Are there essential surgical and or medical skills, like the bare minimum that one must acquire during internship to help you survive during the gap between internship and employment?
Yeah, you need to know how to do a cesarean section. You may get a locum in a place where they do cesarean sections and you'll be told, hey, there's a patient, go do a cesarean section and you'll be paid. you need to learn like basic ICU skills, how to intubate a patient, how to fix a central line. You don't really need to know how the ventilators are set and stuff like that, but those key life-saving procedures like intubating the patient and fixing a central line are things I think you ought to know by the time you're coming out to become a medical officer. And those are also the things that are going to put you at an advantage, especially if you get locums in ICU centers, because locums in ICU centers pay more than what guys are paid as locum in outpatient services. Yeah, so those are the things. The other ones for medical, just the usual things. Some of these things you can even learn them in CLS, things like how to interpret an ECG, how to interpret a blood gas. Some of those things you may actually need to know them. If your center actually has an ECG machine or has a blood gas thingy, if those things are there, learn them. If they're not there, no one will fault you for not knowing. But when you come out, when you're done with your internship, I think you should be having like a notepad and tell yourself, okay, as I'm looking for work, let me see where I can get some experience and learn how to maybe intubate. And some of those things you can actually, KNH is very open to volunteers, especially in the A&D. If you're done with your internship, you can come. We do a lot of intubations, we do a lot of central lines, we do a lot of ventilator settings in the A&D. When you're done with your internship and you never had the experience of those things, just come and apply as a volunteer in KNH. We'll actually be there. We will show you how to do all these things. Yeah.
Oh, nice.
Even if the guys are students, I don't know where you guys go. I see some of you coming to the A&D and you're like, we're looking for intubation. And then, okay, we're not intubating now. And then you all turn and walk away and we're like, okay, oh, okay.
It's an unfortunate culture that's been cultivated, but because those logbooks can be a bit thick. So,
yeah, I noticed, yeah. Okay.
Question from Ahmed. In internship, since it's for a year, do you go about it per department, like 3 months for IMED, OBS, etc.?
Yes, you do, but I think it was changed a bit by the Kenya Medical Practitioner and Dentist Council. I'm not so sure, because I think there's supposed to be a rotation for accident and emergency and a rotation for psychiatry. I don't know how.
Even Com Health.
Yeah, Com Health, yeah. So I don't know how but the calendar is usually done for that. But I think from the Kenya Medical Council, they should be able to, you can get those answers from there.
So, do you recommend trying the route of student exchange programs, which UN provides for few? That's from Hanif. I'm not sure I understand the question, but you can go ahead.
I think that thing, what is it called? It has a name. Where guys come from, like you guys from Kenya, electives. You go to another country, someone else comes here. Yeah, those ones are actually good. It's good to experience outside the country what things are, especially if you can get into a developed country and see what and how medicine is done there. And then you can come back and maybe that experience will have taught you something, will have given you a new fire to do something new, to do a different, maybe you had thought of doing one particular course, but you went there and you realized, the future of this one it's way better than what I was thinking. So you can decide to do something. Yeah, so those programs are actually very helpful. Yeah.
So Hanif and anyone else who has questions on the exchange programs, they're definitely there. They're not available for the whole of med school to do, not yet at least, but there are quite a number of opportunities. So task your Amsun leaders who you voted for to compile that list and share it so that you guys can start applying in good time. You can also do electives locally. You don't have to leave the country necessarily. You can go to public hospitals, to private hospitals. You'll still get a different kind of exposure from what you get at KNH as a student, I think.
Yeah, that's true.
All right. What have you explored the option of providing? That you had answered that question. And then what is the scope of being just a medical officer? We had also answered that question from Hanif. And then from Fred Kamau, according to you and the way today and future technology has been advancing the past 10 years, what does the future hold for medics? Also, what are the new areas of specialization coming up so that we don't specialize in the traditional areas that are likely to be replaced or affected by technology?
Yeah, actually, that is true. There's a lot of medical fields that are now being affected, in quotes, by technology. So we have Internet of Things, there's artificial intelligence that has come in, and especially the aspect of artificial intelligence. Okay, let's start with Internet of Things. So Internet of Things, we are looking at things like your smart watches that tell you 10,000 steps. We now have watches that can actually tell your blood sugar levels. They can tell your pulse rate. They can tell how your heart is beating. Some have actually even been said that they can actually detect myocardial infarction before it happens and actually send a signal to a hospital to come and find you where you are with an ambulance so that they can actually administer first aid and intervention. So the artificial Internet of Things, that's where the impact is coming in. Artificial intelligence is coming in, especially where I have seen the disruption. There was an article in the US where a certain hospital fired their entire radiology department. All the radiologists were fired because they came up with an artificial intelligence system that can interpret MRIs, CT scans, chest x-rays, all those things in, they were saying like almost a quarter of the time it would take the radiologists to do the same. They actually did studies of the AI system and their own radiologists, and actually found that the AI system was actually giving more correct answers than their radiologists. So their entire needs, they were all fired. So when you look at things like that and you realize, especially in areas like now areas like that, like radiology, I'm not saying if you want to become a radiologist, don't become a radiologist. I'm just saying that uko mbele, there is something that's coming. So either you will become a radiologist, but you need to sit down and ask yourself, okay, artificial intelligence is here and it's coming into Africa. It's already in use in some African countries. Yeah. So how can I position myself so that when this thing comes, it doesn't affect me? Rather, I'll be the one moving with it. I'll be the one on that place when it comes. I'll be there at the airport waiting for it, saying, hello, habari yako, AI, twende hivi, you know? So, yes. And also robotics. Robots are now doing surgeries in Singapore, in China. So what does that mean for your general surgeon? You know, so those are the things you need to start thinking about, because you're sitting and you're looking, okay, Internet of Things is replacing outpatient centers. Because if I'm a patient and I have a watch that is monitoring my sugar, it's monitoring my heartbeat, it's monitoring my BPs, why do I need to go to an outpatient center? If it can detect that I'm about to have a heart attack and bring the ambulance to me, why do I need to go to an outpatient center? So you see already, there are things that are coming into play that are phasing out some of our medical things. So at the end of the day, there's still some people who will still require that human touch, that human interaction. Yes, but where we're going, maybe in the next 10, 20 years, artificial intelligence, Internet of Things, robotics are going to be such a major part of the medical field. And I think it's time we begin to learn about what is Internet of Things, what is artificial intelligence, how is it impacting us, how is it impacting our lives? And then from that, as a doctor, look at it and say, okay, fine, this thing is here. So how am I going to benefit from it? What can I do to prepare myself so that when this thing comes, I'm already on the front line? It may require you maybe doing a course in Python programming, because that's one of the languages they use for artificial intelligence. It may require you, you know, just increasing your knowledge and branching yourself off, learning things that are in a different field, because all those things are available online. You can learn about AI, you can learn about Internet of Things and their impact in the medical world. Yeah, so that's where we are heading. You may decide to become like a doctor who deals in robotics. And then when that robot comes to do surgeries, you're the one who's controlling it. Yeah. And you get it paid. So yeah, so Fred, those are some of the things you need to look into. Yeah.
Yeah, there's no escaping it. It's actually in every field. Just join the movement. Yeah. Stay relevant. Join the robot guys. Musiwaogope. Ndong adds on to the question that you just answered. There's a question from Joely Valence. What's your view on medical data analysis as a short course with the future in view? And Ndong adds to this question, does the data science masters that UON wants to offer have a future? Is it worth exploring in Kenya?
Okay, I'm not sure about the medical data analytics short course in UON, but what I can say about medical data analytics, there's a course that's been run by the London School of Tropical Medicine and Hygiene. It's a master's program. It's for medical data analysis. It's a 2-year program that I think, no, it's not online. I think you actually have to go there to do it. But it's one of the things I was looking at and was saying, anyone who will actually go and do this will actually be positioning themselves to a very nice place in the next 10, 15 years, when now, because this thing's already here, but now as they're coming into being implemented, we actually need people who can analyze data. Because what Internet of Things is going to be doing, when they're getting all this information about you, your blood sugar, your heartbeats, your pulse rate, your ETC, all this data is going to be stored somewhere. But that data will need someone to come and analyze it. It can be analyzed by a computer, yes, but it still needs a data scientist who can actually go like, okay, fine, this is what this means to us or to this particular family. Like if Mbuvi has this bracelet and it's saying that he now has developed hypertension, it means we need to start looking at his kids or whether they're also at risk of getting this thing, if this thing is primarily genetic. So yes, medical data science, health data science is going to be, my personal opinion, is going to be one of the major things in the future. Yeah, so Joely, if you're planning on doing it by the cheers, go ahead, encouragement 100%, go do it. But check out the program at London School of Tropical Medicine and Hygiene. Just go through it. Their website has a very nice breakdown of that course, what it entails, what the financial cost to you, or what, and then they will actually explain to you what that health data science is about, your career perspectives, all those things. Yeah.
Speaking of websites, I think I received a direct message from one of the audience members asking for the name of the website for application to faith-based hospitals. It's called CHAK, Christian Hospitals Association of Kenya.
Just go to Google, just type CHAK and then enter. It will bring you away. I think it's chak.org. Yeah, it should bring one of those things. Yeah.
So it's CHAK.
Yeah, CHAK.
A question from Ahmed. I think you had answered it. There was a similar question asked by someone earlier, but I'll just ask the question for the sake of it. Is it enough for one to just do MBCHB and go ahead with practice after internship, or do you need a master's degree to better your prospects? I think you had answered adequately.
Yeah.
We can move on. A private question. Where can we get the recording? It will be sent to the class groups by Amsun External Affairs, I assume. Castro can tell us more later, but they usually made available on your class chats. Again, don't scroll through all of them, just take time and go through the messages sent by your school leaders. Edgar Muthuuri asks, for someone who'd want to go into healthcare management, what can I do in the meantime to prepare?
Okay. So healthcare management has all those components of running hospitals, knowing about stock levels, the things that are needed. Now, in my experience with healthcare management, because at some point I was the deputy HOD for A&D, and one of the things that you're actually working on at that level of management is that you're now at this place where you're now looking at your institution as a whole. You're not dealing with just the patient alone, but when you're on the ground, you're the doctor, you're dealing with this particular patient. But when you come into the management level, you're now looking at the patient, you're looking at the doctors, you're looking at the nurses, you're looking at the support staff, you're looking at the equipment, you're looking at time, there's a lot of things that you're looking into. Now, how can you prepare for it in the meantime? Well, for now, what I would say is this: when you're going for your internship, it could be one of the things that you can put as a side note for what you want to do, and talk to your medical supervisor. I know people who are always willing and ready to show you how the ropes work in particular organizations or institutions, and that's what you can do. There are also several online courses for healthcare management which are free. There's this website called Allison.com. This websites where they offer free like course programs, diploma courses, and etc. They have a lot of them which are into the healthcare management. So you can actually start going through them and learning the components of healthcare management, so that by the time you're going into internship, your mind is already looking at that aspect. In as much as you're taking care of the patients, but you're also able to look at your hospital as a whole and see, okay, if I was the medical superintendent, what would I do? What will I do different? What will I do to encourage the employees? What will I do to make patient care better? Things like that. So you can start with those online courses, just begin to learn the foundations of healthcare management, then now coming to get into the practical aspects of it and knowing the practical things. After internship, you can apply for the Strathmore School MBA in healthcare management. It's an excellent program, which very, very well taught by the I know so many doctors who have joined it. I'm actually even planning on joining it probably later on this year. So yeah, that's one of the things I can say.
How long is the MBA course at Strathmore?
It's a 2-year program.
Okay, full time?
Yeah. No, not full time.
Okay.
So their program it's a hybrid program because they know it was structured in such a way to cater for the guys who are at work. So you have classes for 2 weeks every 3 months. Yeah. So for 2 weeks, you can plan your leave days so that for 2 weeks of that time, hauko job. So you just come do your classes. The rest of the time you're at work. Another 2 weeks, like that, until you're done. Yeah. Then there's an external attachment where you're taken to India for, I think, a week and a half to see how medicine works there, how management is done, how those guys are running their hospitals. It's from the people who have done it, I've gotten very, very good reviews about it. Yeah, so that's it. You can move on.
Sawa, thank you. I had actually just lost my connection for a moment there. So I've lost the last 4 questions on the chat box, unfortunately. If people can just...
I can see them. It's okay, I can see them. I think I can just go through them. Okay, so the first one is from Hanif, who's asking, entrepreneurship in medicine, what are some of the opportunities you can take as one internship? I think one I said is you can come together as a group and decide to open up a facility or open up a clinic that can start. But in regards to entrepreneurship and medicine, I may not be able to give you the best advice because it's not one of the things that I have actually tried. But I think with Nikita, you can try. I think I can get the contacts for the doctor who runs the Roy Family Home, and you can talk to him, and then you can organize a session. And also, there are like 2 or 3 doctors who have done entrepreneurship and medicine, and I think there are also my contacts on LinkedIn. I can send you, then you can actually contact them and have a session like this one, because I'm sure they'll give you guys much better ideas than I can, because I've not really delved myself into the entrepreneurship and medicine side. Yeah.
Sawa.
Okay. Then there's one from Victor Otieno, who says, I work part-time as a software developer. What are some of the ways I can blend my mix of medical knowledge and technical knowledge of the web to help create software that may help other medics and patients? First of all, Victor, excellent. This is good. As it's nice to see guys who have other things that they're doing on the side, and as a software developer, this is excellent. So one of the things I can ask you to go look into, there's a company called Smart. Now, you know, when you go to a hospital and you have your Smart insurance card, there's that place where you place the card and then you're told to place your fingerprint on it and then it reads. Now, that entire system that's called Smart, it was actually developed by 2 doctors. And let me just tell you, those guys usually smile all the way to the bank because they hold that entire Smart system. So I think you can actually, I think you can find their story online and see what they did. But I'll try and get, okay, I don't know. Unfortunately, I don't have their contact, but I may know someone who knows someone who might know them. It's like a line. But anyway, so those are the things. So those guys developed that Smart system that actually helps to read insurance cards and show how much balance you have in insurance card and etc. and etc. So those are some of the things you can look at. You don't really need to look at the aspect of how do I affect the patient as well, but you can look at the supply chain. You can look at how can I develop a software that can get this thing from here to this particular place in that value chain, or from patient to doctor to hospital and things like that. So it doesn't have to be something that will work specifically on the patient, but it can be something like that Smart system that reads insurance cards. Maybe you can look into, I don't know, how guys are going to, if you can create a program. Let me give you an idea. By the way, you'll pay me for this. Like a percentage.
I'm sure Victor may
Okay.
steer.
Yeah, so one of the things you can look into, because one of the challenges I've seen in the medical field, especially, is how to manage human resources. So if you can create a software that can either have an aspect of artificial intelligence, where, let's say, for example, if this month, February, I decide I want to work, okay, I don't want to work the last week of February because I have some things I need to do, that I can actually go into that system and write in that system that, yeah, I want to be free from Monday to Friday in this particular week. Then if the hospital HR policy says that I'm supposed to work 40 hours a week, then that system can actually look and say, okay, fine, Mbuvi doesn't want to work this last week, but how can we arrange such that for the days that are left, we can actually have him work the 40 hours a week that he needs, extrapolated for the whole month, like an AI system of sorts, like a physician planner or a HR planner. Actually, believe it works, believe you need to pay me something. 5% of the time.
Tupatie namba ya Victor muongee.
Victor Manzuta itafuta. I'm always in A&D. You'll find me there. Just come and ask for Mbuvi. They will find me and we'll talk. Yeah. Okay. But Nikita, I think the time is really going, and
Yeah.
I have phone calls on the side. People are calling me. I don't know now what we'll do about the rest of the questions.
We can. Okay, we'll compile them and then send them to you, and then you
Yes.
can respond to them briefly in an email. Yeah.
That will work. That will work. That is fine.
But I think you tackled the bulk of them extensively.
Okay. Sawa. So, Nikita, thank you so much for this opportunity. We have gone way above the time limit, but it was enjoyable. I enjoyed answering the questions. I've enjoyed the interactions. Guys, thank you so much. If anyone ever just wants to come and have a chat with me, you'll find me in A&E. Just come ask for Dr. Mutua. If I'm there, whether we can find time as we learn how to intubate a patient or fix a central line, we can have a discussion on other things that matters. Yeah.
Oh, thank you very much. I noted that the majority of the audience has stayed to the end of the.
Thank you so much, guys. Thank you so much.
So everyone in the audience definitely really appreciates you taking the time to talk to us and being so engaging. Isikuwe kama another pharmacology lecture. So thank you. That's all I have to say. We will be sure to follow up on the pointers that we've identified in the course of the session. Have a nice evening, everybody. Have a nice evening, Dr. Mutua.
Thank you.
See you guys next time.
Okay. Have a good evening, guys. Thank you so much.